No one would have imagined at the start of 2020 that the world would be grappling with a pandemic by March. As governments scramble to respond, the virus has spread to over 140 countries, causing turmoil in the global economy and disrupting supply chains. So how can governments prepare for a viral outbreak before it spirals out of control? The disease, which is officially known as COVID-19, was first reported to the World Health Organization on the last day of 2019. With the death toll rising daily, governments have imposed travel restrictions and social distancing measures in a bid to contain the pandemic. In an extreme case, China imposed a lockdown on the city of Wuhan's 11 million inhabitants on January 23rd, the first of many draconian measures, including surveillance and enforcement. But is this the only way to contain a virus? Masks, thermometers, quarantine notices, and travel restrictions. These are some of the tools governments are using to try to contain the coronavirus pandemic. Global deaths and infections surpassed those inside China for the first time on the 16th of March. 3 days later, China hit a milestone with no new local infections reported. However, outside of China, the number of infections continue to climb, with each country adopting a different approach to stem the spread of the virus. As the public and private sectors race to develop a vaccine for the coronavirus, innovations to help identify or limit the spread are also equally important, if not more. These solutions include drive-through temperature screenings, now seen in places like South Korea and the US, and even remote monitoring systems now being used in Hong Kong.
Bioformis is a digital therapeutics company, and digital therapeutics is a new category of medicine where you're essentially using software to treat and manage a disease.
This technology, it was developed for heart disease and the likes. So what was the point that you realized that it could be applied to this new disease?
In a matter of 2 weeks, our team built together and customized our existing solution for COVID-19, which is geared towards remotely monitoring patients to detect early signs of symptoms.
The medical device, known as the Avarian, is worn by the user on the arm. I got a first-hand look at how it works.
It has medical-grade sensors embedded, and it captures 20-plus physiological parameters.
What are the more important ones when we're talking about coronavirus detection?
The most important ones are heart rate variability, respiration rate, blood oxygen separation, and also skin temperature. And then all the information will transmit it to the clinician dashboard. So this one, the clinicians can view all the patients in the one page.
The company is working with the University of Hong Kong and Hong Kong health authorities to remotely monitor patients who are quarantined or already diagnosed with COVID-19.
The platform can be used by drug companies in their clinical trials to understand the efficacy and effectiveness of the drug.
Are there any plans to roll this out beyond Hong Kong?
Currently, we have been in discussion with multiple government authorities, including Singapore, the United States, Australia, Italy, South Korea. When a pandemic like COVID-19 breaks, time is of an essence. So multiple people or stakeholders in the industry need to come together. People who are actually building diagnostics for COVID-19, people who are innovating to build novel therapies and treatment. You need to start working with regulatory agencies, start working with government agencies who are going to take initiatives to roll the program out.
But these tools are only as effective as the people and policies attempting to contain a virus. Outside China, Singapore, South Korea, and Taiwan have been highlighted for their efforts to curb the outbreak, involving not just the government, but the private sector and citizens too. Professor Fong Kok Yong is the co-chair of a disease outbreak task force in SingHealth, a cluster of healthcare institutions in Singapore.
All health systems are designed to treat patients during peacetime. Therefore, no health system is designed to just meet with any unknown pathogen or, in this case, an epidemic. It's important to have a task force to make sure that we are prepared. Our main role is to harmonize, make sure that things are done in the correct way, share practices.
Dr. Danielle Anderson is a scientist and one of the many people in Singapore involved in the fight against the pandemic.
We were prepared because, as someone who works on coronaviruses previously, we were looking at the outbreak in Wuhan, and so prior to patients in Singapore, we already had a plan in place of what should we do when we get patients.
Samples from infected patients are sent to Danielle and her colleagues for analysis.
What we're doing is trying to isolate the virus from those samples and then looking at changes in the virus, and then we feed back to the hospital.
How close are we to a vaccine?
We still have some way to go. We really have to make sure that what we're doing is not harming people and that what we're giving them is no worse than the disease. In the timeline, I would guess that we're at least 18 months away for the vaccine to actually be deployed to the general population.
A crisis of this magnitude calls for a global response. That's where international agencies like the World Health Organization and the International Monetary Fund come in.
We have about $50 billion that are available to low-income countries and to emerging market economies that can get access to this money without a program with the fund. In other words, immediately.
The World Health Organization estimates that 89 million medical masks, 76 million examination gloves, and 1.6 million medical goggles will be needed each month to respond to the pandemic adequately. While it has shipped almost 500,000 sets of equipment to more than 47 countries, supplies are rapidly depleting due to panic buying, hoarding, and misuse. Panic buying of daily necessities and medical supplies such as masks and hand sanitizers has been reported in many countries. This has resulted in shortages, which puts frontline workers like doctors and nurses at a higher risk in their line of work. Economist Walter Teixeira says the pandemic has revealed structural weaknesses in our supply chains.
Many of our industries have had their supply chains disrupted to some extent, or their trading arrangement disrupted. Because, for example, you might have a factory or some process in Singapore that depends on the supply of parts from China, and now the disruption has spread to Europe and spread to the United States as well. We cannot diversify against risks that happen in terms of our relationship to the rest of the world. What we can do is we can try to ensure that we are more resilient to such shocks.
In response to the shortage in medical supplies, the private sector has stepped up too. Companies like the French luxury group LVMH, Taiwanese manufacturer Foxconn, and Singapore e-gaming company Razer have shifted their manufacturing plants to produce medical supplies.
What we see in some countries, very sadly, they may not have the test kits. Public health system may already be overcapacity and overwhelmed. They may not have the ability, even in their police or security agencies, to help out, with the contract tracing. They just don't have the institutional capacity to do all of these things. Many of us have these jobs where somebody is paying us even if we phone in and say, hey, I'm sick, I can't come into work today or tomorrow. Many people don't have that luxury. That's one of the key weaknesses that is now being exposed in many countries, that the social and health insurance systems are just not set up to give people the support they need to be socially responsible.
Many countries have also imposed travel restrictions in a bid to halt the spread of the virus, with some even going as far as to institute travel bans, despite the skepticism of public health experts on their effectiveness. Singapore's Changi Airport is one of the world's busiest airports, and while staff there have been busy screening passengers for flu-like symptoms and disinfecting surfaces, it hasn't been easy to keep up.
As the situation is evolving very rapidly in different countries, travel restrictions get imposed on different passengers coming from different countries, sometimes by the minute. So here on the ground, this is the key challenge that I think we face in responding to the evolving situation, working with airline partners, working with our enforcement agencies to respond to all these changes, ensuring that the airport remains operational to keep this place safe.
While having the right health policies is a step in the right direction, containing a virus is not just the responsibility of governments but citizens too. This means being socially and psychologically responsible, practicing good hygiene and not hoarding supplies unnecessarily.
I can summarize in an acronym called PACS. P meaning be prepared, A meaning adaptable, C for communication, and we take communication very seriously. The last, be supportive. If we are able to do all this, then it really helps any health system or any healthcare facilities.
Hey guys, how is your country dealing with COVID-19? Would really appreciate if you drop your thoughts in our comments. Thanks, and in the meantime, stay safe.